Well, the event was primarily planned by the Wellness at Work Committee, which incorporates various people from many disciplines on campus. So we were looking for an opportunity to bring people back together to try and recreate that community spirit that people used to have working here on the St. Stephen's campus that had been lost primarily through COVID. So this was an opportunity for us to have this event to bring people from the various different agencies together, to spend some time together, to eat together, to break bread, to have some fun.
I suppose the main core element about planning first and engaging first was about bringing people together. We had found that over the COVID period in particular, the fabric of the campus had kind of ebbed away because people were self-isolating, and rightly so, and following the rules. But that led to people, particularly new staff, not knowing other departments, other people, even their neighbours in their next door office. So I suppose the Health and Wellbeing Committee took many months in relation to planning for this. It was a great meet and greet, people meeting with each other and engaging with each other, and even if everyone was hopeless at it, we were all hopeless at it together. It was a great trust and building exercise. Then Richard and his team here in the canteen had an outstanding barbecue laid out. I won't even go on because it would make you too jealous that you weren't here. What the delights that he had on the day. And it was just a brilliantly organised event, and then it ended up with music, bingo and games. We had a DJ here who was a member of staff who delightfully asked to come in for the day, and it was just 2 hours of fun and gallery.
We'd hope to do something also at Christmas time to bring people together, even just for a cup of tea and a few mince pies. We are definitely doing the barbecue again next year, and we're looking for other ways to promote and create the community atmosphere that we've been missing so much in St. Stephen's. So we're always looking for new ideas.
So the project is the development of a toolkit for Wellness at Work committees, and we developed this because we have up to 82 committees now across Cork and Kerry, and we have a very small staff health team, so we needed a way to support these committees without us being able to be there hands-on for them. So we developed a toolkit that has everything that new or existing committees might need to set up effective health promotion programs for their colleagues. So the toolkit contains 5 booklets, and it really is to help committees get it set up and established. So the first booklet sets the context for why staff health is important, and then our second booklet is setting up a wellness committee, how to do it from the very idea stage right through the development of an action plan. Then our third booklet contains all the ideas you might need to give you inspiration for your action plan, and they're grouped by topics, so by physical activity, healthy eating and so on. Then our fourth booklet is case studies, and this one is the one that's probably most appreciated because it gives you lots of ideas of other projects that existing Wellness at Work committees have developed throughout Cork and Kerry, so you can see what other colleagues have done in other areas, and that's giving lots of inspiration and creativity to new committees in terms of projects that might work for them. Then our last booklet is a resource booklet, and this is all the templates you might need to help set up a committee. We understand the staff are really busy and that having Wellness at Work initiative is an extra on top of their daily workload. So this last booklet gives you all the templates you might need, so it makes it easy for you. We actually don't make it available online, and that is because even though the toolkit is there to help empower them and give them the skills and knowledge to develop committees, we do want them to know that we're still there to support them. So we ask them to email us first so we can still have that connection and contact with committees. You know, our staff need to be acknowledged for the hard work that they've done, and staff health and wellbeing is a wonderful way to do that, and it helps boost morale, it helps reduce absenteeism, it helps increase productivity and just build wonderful relationships amongst colleagues as well. So they've been through a tough time. I think we all have, but particularly the HSE, particularly the frontline staff, and staff health initiatives are more important now than ever.
You know, the HSE is a female-dominated workforce. Over 80% are female in the HSE, and in Cork and Kerry alone, there's over 50,000 women in menopausal age between 45 and 55 years. So we hosted a webinar in March 2021, and we had a general overview of what menopause was. It was really well attended by staff. And the feedback at the end of it was that they'd like more specific information around the topics, because there was a lot of information to take on board. and we held a follow-up webinar then. So as a follow-up to the webinars, we've developed a booklet, Let's Talk About Menopause, which has really brought together all the specialists that we had on the webinar.
It was innovative in that we think it is the first booklet of its kind to bring the selection of disciplines together, so the mix of expertise, and to cover information on the menopause on both the medical management and the lifestyle management. I think the huge benefit of working on this project was the fact of bringing together the multitude of disciplines from different backgrounds. It was hugely informative, I suppose, from us all to hear about our expertise in the various different topics. We look at what is the menopause and perimenopause. We're looking at the HRT, hormone replacement therapy, explaining that. We're looking at the pelvic floor during menopause, and also managing the psychological symptoms associated with menopause. And then sort of health promotion, lifestyle aspects we look at is physical activity during menopause, and also how to eat well. We can get our health information from a variety of sources. This is not always reliable, so it's the benefit really of this booklet is that we have the up-to-date evidence-based information. It's accurate, it's relevant for the Irish population, and I think this was probably the biggest benefit.